If you or someone close to you has had a persistently hoarse or raspy voice for weeks or even months, and the explanation has simply been too much talking, or probably acid reflux, please watch this video to the end. What follows could be one of the most important pieces of health information you hear this year. A voice that stays hoarse is not always just a tired throat. In medicine, persistent unexplained hoarseness is classified as a significant red flag symptom, one that requires urgent investigation. The reason goes deeper than most people expect, and it starts with a piece of anatomy that surprises almost everyone. The nerve that controls your vocal cords is called the recurrent laryngeal nerve. What makes it remarkable is its path through the body, rather than running a short, direct route from the brain to the throat. This nerve travels down from the brain into the chest, loops around major blood vessels deep inside the thorax, and then comes back up to reach the vocal cords. The left recurrent laryngeal nerve specifically hooks around the aortic arch, the great curve of the body's largest artery, before returning upward. This long, looping route through the chest means that anything abnormal growing in the lungs, esophagus, lymph nodes, thyroid, or even the major blood vessels can press on or invade this nerve and cause the vocal cords to stop working properly. In other words, a hoarse voice is not always a throat problem. It can be the first audible signal of a disease developing silently deep inside the chest. When should you stop waiting and see a doctor? The answer from current clinical guidelines is clear, and more urgent than most people realize. Any unexplained hoarseness lasting more than 2 weeks warrants an ENT evaluation. Updated international guidelines now recommend formal laryngoscopy, a direct look at the vocal cords. If hoarseness persists beyond 4 weeks without a clear benign explanation, the older threshold of 3 months has been shortened significantly, because delayed diagnosis carries real and measurable consequences. For smokers or regular alcohol drinkers over the age of 40, 2 weeks of unexplained hoarseness is itself enough justification to go directly to a specialist. If your hoarse voice has already lasted months, the time to make that appointment is today. Let us go through the serious conditions that can hide behind a persistent hoarse voice, starting with the most well-known and moving toward the ones that will genuinely surprise you. The most directly linked serious cause is laryngeal cancer. Hoarseness in laryngeal cancer, particularly cancer of the vocal cord itself, is not a late symptom. It is actually the earliest. Even a very small lesion on the vocal cord disrupts the precision of sound production immediately. This is both a danger and an opportunity. It means laryngeal cancer can announce itself before it has grown large or spread. The 5-year survival rate for early-stage laryngeal cancer, discovered at stage 1 or 2, reaches 84 to 90%, and in many cases, radiation therapy alone can achieve a cure while preserving the voice completely. Survival drops to below 45% once the disease reaches stage 3 or 4, and at that point, total removal of the larynx and with it the natural voice may become necessary. Smoking is the dominant risk factor, increasing laryngeal cancer risk by roughly 5 to 15 times compared to non-smokers. Alcohol amplifies that risk further, and the combination of both is not additive but multiplicative. Among laryngeal cancer patients, 94% are male, reflecting these lifestyle-driven risk patterns. A male smoker over 40 with hoarseness lasting more than 2 weeks should treat this as a medical urgency, not a minor inconvenience. The second serious cause is lung cancer, and this is where many people are genuinely surprised. Lung tumors, particularly those in the upper left lung or in the mediastinum, the central chest space between the 2 lungs, can directly compress or invade the recurrent laryngeal nerve. When this happens, the vocal cord becomes paralyzed, and the result is a hoarse, breathy voice with no obvious problem visible in the throat itself. Both the National Cancer Information Center and leading medical institutions list hoarseness explicitly among the warning symptoms of lung cancer, because lung cancer produces no symptoms in the vast majority of cases until it is already advanced. A hoarse voice caused by nerve compression from a lung tumor is paradoxically one of the rare early windows through which lung cancer can be caught at a treatable stage. For any current or former smoker. With hoarseness lasting beyond 2 weeks, chest CT imaging is not optional. It is a necessary part of the evaluation. The third cause is the one most people will never have considered. A thoracic aortic aneurysm, an abnormal ballooning of the body's largest artery inside the chest, can grow large enough to compress the left recurrent laryngeal nerve, as it curves around the aortic arch. The resulting hoarseness has a medical name: Ortner's syndrome. It has been described in clinical case reports for well over a century as an unexpected first sign of a life-threatening vascular emergency. An aortic aneurysm is often called a silent time bomb, because it produces no symptoms until it ruptures, at which point the mortality rate becomes extremely high. Without immediate emergency surgery, a hoarse voice appearing before any rupture, therefore, represents one of the most critically important early warnings the body can produce for this condition. The fact that this cause exists is precisely why hoarseness, with no obvious throat explanation, requires imaging of the chest, not just examination of the vocal cords. The fourth cause is esophageal cancer. The esophagus runs immediately behind the trachea, and in close proximity to the recurrent laryngeal nerve. As esophageal cancer grows and spreads into surrounding structures, it can compress or invade this nerve and cause hoarseness. The critical point with esophageal cancer is that, by the time hoarseness appears, the disease is typically already in an advanced stage. The earlier warning sign, one that precedes hoarseness, is progressive difficulty swallowing, called dysphagia. It typically starts with solid foods like meat or bread, then gradually worsens until even liquids become difficult to swallow. If you have both a hoarse voice and any difficulty or discomfort when swallowing, along with unintentional weight loss, esophageal cancer must be actively excluded through endoscopic examination. The fifth cause is thyroid cancer or rapidly enlarging thyroid nodules. The thyroid gland sits directly in front of, and just below the larynx, in anatomical proximity to the recurrent laryngeal nerve. A thyroid nodule that grows quickly, or a thyroid cancer that extends into surrounding tissue, can compress or invade this nerve, producing vocal cord paralysis. The key warning combination here is a palpable lump, or nodule in the front of the neck accompanied by voice change. While the vast majority of thyroid nodules are benign, any nodule that comes with accompanying hoarseness or vocal cord paralysis carries a substantially elevated risk of malignancy, and requires immediate ultrasound and fine needle biopsy. There is one additional emergency combination worth knowing. If hoarseness occurs together with a drooping upper eyelid on one side, a smaller pupil in that same eye, and reduced sweating on the face, this triad is called Horner's syndrome. It is a major neurological red flag pointing to a Pancoast tumor, a lung cancer growing at the very apex of the lung, that compresses the sympathetic nerve chain. This combination demands emergency imaging the same day. Here is the clear framework for when to act. Hoarseness that appears after shouting, a cold or vocal strain, and resolves within 1 to 2 weeks is typically benign. Hoarseness that persists beyond 2 weeks without a clear benign explanation requires an ENT visit. Hoarseness beyond 4 weeks requires laryngoscopy. If you are over 40 and smoke or drink regularly, move faster than these timelines. Go at 2 weeks, not 4. Get same-day or urgent care. If hoarseness is accompanied by any of the following: a lump in the neck, difficulty or pain when swallowing, unexplained weight loss, blood in cough, shortness of breath or wheezing, ear pain, radiating down the shoulder or arm, or that 3-part combination of drooping eyelid, small pupil, and reduced facial sweating. What happens when you go to the doctor? An ENT specialist will perform laryngoscopy to visualize the vocal cords directly, which identifies nodules, polyps, tumors, and critically, vocal cord paralysis. If paralysis is found without an obvious local cause, imaging of the chest with CT scanning follows to search for the underlying driver, whether that is lung disease, vascular abnormality, or a mediastinal mass. From there, the workup expands based on findings. The pattern that repeats in clinical practice is that many patients with laryngeal cancer wait several months after hoarseness begins before seeking evaluation. That delay is the difference between treating a stage 1 cancer with radiation and preserving the voice completely, versus facing stage 3 disease that requires laryngectomy. For the patient with hoarseness caused by lung cancer or aortic aneurysm, that same delay may be measured in far more severe terms. This video is for general health information only, and is not a substitute for professional medical advice, diagnosis, or treatment. If you are experiencing persistent hoarseness or any of the symptoms described, please consult a qualified healthcare professional without delay.